Hey guys, today we have a patient who has suffered from 4 plantar warts on his left foot. He has had these warts for more than 4 years now and he has tried all the conservative treatments with no unfortunate success. And so today he has elected to undergo a wart removal surgery to increase the chance of getting rid of these warts forever. So plantar warts start off as a lesion on the bottom of the foot, which are known to be caused by the human papilloma virus or the HPV virus. The warts are not exclusive to just being on the bottom of the foot, but can occur anywhere on your foot and even on the top of or in between your toes. So warts can transfer onto a person's skin by someone simply stepping barefoot onto a surface that has the virus. The virus infects the superficial layers of the skin, which leads to a replication cycle within the epidermis, culminating in warty growth. There are a few ways in which the virus may enter your body. This may include trauma, portal of entry, cracked, dry skin, or even a wound, or could occur due to a compromised immune system or from certain medications that suppress your immune system. Warts are most commonly picked up in places where many other people might be barefoot and may even have warts on their feet themselves. Some of the most common areas are swimming pools, public showers, and gyms, pretty much where people are sometimes barefoot and moisture is present. Warts only live on the top layer of skin, but as the wart grows and multiplies, it somehow pulls the blood vessels and, in some chronic cases, the nerves from the deeper tissue to the top layer of the skin. And that's why warts can be so uncomfortable and painful to walk on. And in most cases, people don't know they have a wart until it starts bothering them, because there's basically a foreign object on the bottom of the foot and it's under a lot of pressure. When we are standing, the body builds up hard skin to cover the wart. And as the hard skin builds, it starts applying too much pressure and then we get pain. So now that we have an understanding of what warts are and how someone can get them, I'll be talking you through a routine wart removal surgery that we do at Bexley Podiatry Clinic. We started off this surgery by numbing the entire sole of the foot. Now we did this by injecting local anesthetic onto the medial side of the ankle, where the tibial nerve is located posterior to the medial malleolus. We then go ahead and inject each wart with a mixture of a short-acting and long-acting local anesthetic with adrenaline. This allows for minimal bleeding to occur and provides numbness for the patient for a longer period of time. So plantar warts do not usually grow into the deeper tissue, such as the dermis or the subcutaneous tissue. They only grow within the top layer of the skin, as to say the epidermis. So cryotherapy, salicylic acid and hydrogen peroxide can be very effective treatments for plantar warts. However, for persistent and chronic warts like we have here, they do tend to get thicker and harder over time, and those therapies tend to not work as well. And so with multiple ongoing unsuccessful treatments, we can put a patient at a higher risk of trauma, as damage to that wart area creates more callus buildup and scar tissue, making the skin harder and the wart even deeper. And so for stubborn, difficult warts, surgical removal can be a very effective option. And right now we're injecting local anesthetic directly below the wart area, aiming to numb the lateral plantar nerve. We try and achieve a blanching and raise of that skin to ensure an effective field block. So we aim to debride hard callus to expose the lesion clearly. What's interesting about warts, the HPV virus mutates the epithelial cells into viral cells, causing them to proliferate much more rapidly than normal. Now once we are down to that level where we can see the circumference of the wart, we can stop debriding the skin. The blade is changed to a size 15 fine blade to score the wart. So we initially score around the wart and start off shallow, but maintaining a perpendicular motion to the skin so the blade does not skive. Once we go through the epidermal layer, we will go a little deeper until we see the epidermal-dermal junction. We will then use the belly of the blade to lift the skin up. Warts are a lot wider underneath than they are on the top of the skin, so we make sure to clear the periphery. Warts grow in a tough, rubbery capsule-like manner and usually pull right off the bottom layer of the epidermis. By using a curette, we loosen and scoop the lesion and the surrounding warty tissue. The wart cavity is then cauterized with phenol. This assists in preventing vessel bleeding and causes an inflammatory reaction which aids in the resolution of the wart lesions. We then evaluate the periphery of the lesions and debride a little more if need be. And once we have a nice red base with no thickness around the periphery, we can then stop debriding. And so that concludes our first wart curettage. The same steps will be repeated for the remaining 3 warts. The wart areas will heal without any stitches and will fill up pretty quickly. We expect the warts to heal in 5 to 6 weeks. A reassessment will be performed to ensure no regrowth of warty tissue has occurred.